Welcome to Dr. Balga's podcast for the Curious Doc. Today is February 17, 2026. This video is on a JAMA Internal Medicine article published yesterday titled Incidental Rotator Cuff Abnormalities on MRI. There was an accompanying editorial titled MRI Abnormalities and Incidental Age-Related Changes. Shoulder pain affects about 18 to 31% of the adults monthly. Rotator cuff abnormalities are frequently implicated. The objective of the study is to determine the prevalence of rotator cuff abnormalities and association with shoulder symptoms. This is a Finnish study. It was a population-based cross-sectional Finnish imaging of shoulder study. Sample size and demographics. The study cohort comprised of 602 adults aged between 41 and 76 years, mean age 58. About half, 52% were female, and 18%, there's about 100 individuals, reported recurrent symptoms. The imaging was bilateral 3 Tesla MRI imaging. Rotator cuff abnormalities were classified as normal, tendinopathy, partial thickness tear, and full thickness tear. Statistics included multinomial logistic regression adjusted for age, gender, education, region, coexisting MRI abnormalities, and clinical tests. The overall prevalence, 98.7% had greater than one abnormality. Tendinopathy was present in 25%, partial thickness tear in 62%, and full thickness tear in 11%. Age gradient for full thickness tear, 0% for those less than 45. So the young people didn't have full thickness tear. And 28 to 29% above the age of 70 had full thickness tear. Asymptomatic versus symptomatic shoulders. Rotator cuff, 96% were asymptomatic abnormalities and 98% in those with symptomatic shoulders. Full thickness tear, 6.5% were asymptomatic and 14.6% were symptomatic. The difference was 8.1%, high single digit increase. After adjustment for differences, the difference was 0.8%. The limitation of the study, cross-sectional design, there was a limited younger population cohort. Large tears were uncommon, and MRI was done without arthrography. The key takeaway was rotator cuff abnormalities are nearly universal after age 40. There is a poor concordance with symptoms. Routine imaging for atraumatic shoulder pain should be reconsidered. What does the accompanying commentary say? The insights from the commentary are: most MRI detected tears reflect age-related degeneration. I guess we all aging people are rotting tomatoes. Imaging findings often fail to distinguish symptomatic from asymptomatic shoulders. The clinical implications: diagnosis should prioritize history, clinical examination, and functional limitation. MRI confirms but does not establish diagnosis. Management strategy: 6 to 8 weeks of conservative therapy, including rest, NSAIDs, and physical therapy before imaging in atraumatic cases. The important point is that terminology such as tear may provoke anxiety, and therefore contextualization is essential. Clinical pulse: high pretest probability reduces diagnostic specificity of MRI. Most full thickness tears are asymptomatic. Adjustment analysis eliminates symptom association. Clinical examination outweighs imaging. Degeneration is not equivalent to disease. and to avoid anchoring bias and MRI findings. These are some related eponyms related to rotator cuff. Hit pause and read at your leisure. Podcast brought to you by masterbedfacts.com. This podcast is for physicians and healthcare providers. If you enjoyed this video, please like, subscribe, and forward to your friends.